So I'm assuming that a lot of you are here because you have some sort of interest in naturopathy, because you've heard of naturopathic medicine. Has anyone gone to see a naturopath before? One person, okay. All right, so if you are interested in in going into naturopathy, I would suggest going to see a naturopath and seeing what it's all about. So I'll just get started. So this is just going to be our outline for today. So my name is Jessica Beattie, and I graduated from the Boucher Institute of Naturopathic Medicine in New Westminster, which is a suburb of Vancouver. I have a Bachelor of Science from the University of Winnipeg. I am a registrant of the Manitoba Naturopathic Association here in Manitoba. I'm a registrant of the Canadian Association of Naturopathic Doctors, which is obviously Canada-wide. And I do offer additional therapies other than just being a naturopath. Neural prolotherapy, which is a therapy for pain management. Intravenous therapy, typically vitamins, minerals, different nutrients. Intravenous chelation therapy, and bone therapy. So what is naturopathic medicine? A naturopathic doctor uses a healthcare approach that blends modern scientific medical theory with centuries-old traditional healing techniques to address the root cause of illness rather than to treat or suppress symptoms. So that's a large part of where I differ from a traditional medical doctor. You go to a medical doctor to manage your symptoms a lot, and typically medical doctors don't really look at addressing the root cause of what's going on. Sorry, I'm losing my voice. So a typical visit with an ND, the first visit will last about an hour and a half, during which time I will look at every aspect of your health, including your emotional, your physical, your mental, your spiritual, and your social dimensions. So it's quite a long, drawn-out process. Typically, you'll see a naturopath first, and then I'll want to see you again in about a month, and then after that, every few months or so, just to check in. So the therapies that I offer, I kind of put these in a bit of an order, depending on how often I use them. So nutritional and diet therapy is huge. I definitely focus a lot on nutrition and a lot on lifestyle counseling as well. So diet and lifestyle are very key aspects to health. So if you are not eating the right foods and your lifestyle is not optimal for yourself, you're not exercising, you're potentially drinking a lot, staying out late, not getting enough sleep, your health is going to suffer because of that in most cases. So diet and lifestyle counseling are a huge part of my approach with my patients. Botanical medicine is one of the modalities that I studied. So botanical medicine that's herbs basically. So we use a lot of herbs, and as you know, a lot of pharmaceuticals are derived from a lot of the herbs that we use. So botanical medicine is a very powerful form of medicine. Intravenous nutrient therapy, I do use a lot of IVs, so for all kinds of reasons. So IVs, vitamin C, B vitamins, minerals, amino acids. So I do a lot of that, particularly for my patients who are having more serious health issues. Nutraceuticals, so that's going to be your supplements, basically. Typically, naturopaths will use supplements that are pharmaceutical grade, so you can't really get these types of supplements from a health food store. Acupuncture and Chinese medicine. I love acupuncture and Chinese medicine. I haven't been using a lot of it lately, but it's a wonderful way it's a wonderful way to reduce stress, to treat chronic pain, anything. Acupuncture is wonderful. And homeopathy, I'm also trained in homeopathy. It's a different type of medicine. It's typically referred to as an energetic medicine. If you have questions about homeopathy, you should come and talk to me afterwards. It's a little bit difficult to explain, and I don't really have enough time for that. And physical mobilization techniques. So we do use naturopathic manipulations, which is, in simple terms, is basically chiropractic medicine. Bone therapy is prolotherapy and neural prolotherapy are three that I do separately. Typically, naturopaths are non-pharmaceutical, although in BC, the naturopaths there were just granted their prescriptive rights. So in BC, naturopaths are able to prescribe pharmaceutical drugs. Whether they choose to do that, it depends on the doctor, of course, and it depends on the condition. If you've got an infection that's completely out of control, definitely it's a good idea to potentially use an antibiotic. But in most cases, it's not necessary to use pharmaceuticals. So definitely depends on the doctor if that's an option for you. All right, so my education. So if any of you are interested in becoming a naturopath, you do need an undergrad pre-medical degree. And of course, GPA would play into factor there. So you would have to have a pretty good GPA to be accepted into a naturopathic school. At naturopathic school, it's 4 years with 2 years of hands-on clinical residency. So it's very similar to medical school. After your medical training, there is a North American-wide system of exams that you'll be asked to write. So these are standardization exams. So every naturopath in North America who graduates from naturopathic school has to write these exams in order to be a candidate for licensing in their particular province or state. And then again, there's 2 of them actually. There's one after your 2nd year and then there's one after your 4th year. And they're grueling, they're terrible. But you have to do it. And then there are provincial licensing exams. So for each province in Canada where naturopaths are licensed, you have to take a licensing exam, which typically is a real life situation. Well, it's a mock situation, but it's supposed to be like real life. Where you would be the doctor and then someone else would be acting as the patient, something like that. And then just a typical exam talking about, the different rules and regulations in the province for naturopaths. And after that, so continuing education is a huge part of being a naturopath. Every 2 years, to satisfy your license requirements, you have to complete 40 hours of continuing education credits, plus an extra 2 hours for each separate modality that you use. For myself, I use bone therapy, neuroprolotherapy, intravenous therapy, so I would have to satisfy 46 hours extra every 2 years. And so that will include going to conferences and going to seminars and doing different sort of education requirements to keep up with the latest research and all of that. So it's definitely a continuous learning experience. Okay, so the schools that are offering naturopathic medicine now in North America, there are 2 in Canada. There's one in Toronto and there's one in New Westminster, just outside of Vancouver. So Boucher, which is the one that I had gone to, is one of the smallest. It's great because I had 36 people in my class, and we were on a one-on-one teaching basis with our professors. We used a lot of case studies. It was intimate, so it was a great learning experience in that way. Some of the other schools, the college in Toronto is a bit bigger, so the class sizes are over 100, so probably would fill a lecture hall like this. And they all range in price for tuition. My tuition for Boucher when I started was about $17,000 a year. It's now up to about $25,000 a year. The Canadian College in Toronto, I think, is still around $20,000 a year. And then the ones in North America in the US are upwards of $30,000. Bastyr, I think, is at $30,000 a year. So it's quite pricey. But, CIBC has a really great lending program, and they lend to naturopaths in particular. So they definitely will help you out with that. They have a professional line of credit just for naturopaths, so that's nice. Okay, so everyone always asks me, well, what are you? You're a naturopath? Are you a real doctor? Well, yes, I am. And I like to bring light to this slide right here. This is comparing medical doctor and naturopathic doctor schools, the first 2 years, which are typically the more basic science years, where you learn the majority of your really basic science. So the green is naturopathic, and the black is medical. So I can't see it on my screen. I don't know how you guys can see it. So the first, anatomy. So we have more anatomy training, more biochemistry training, a bit less histology, more physiology, more pathology, a bit less micro, a little bit less pharmacology because we don't use pharmacology as much. Now, this is the key difference, systems-based courses. So in medical school, they typically will have a course based on just respiratory diseases or just cardiovascular diseases. In naturopathic medical school, because we look at the body from a holistic perspective and we take a step back and we say, well, what is going on with this person? They may have digestive issues. They may have IBS, for example, irritable bowel syndrome. But why do they have IBS? There's factors like stress that are contributing to that, and different foods that you're eating that are contributing to that. So really, the systems-based courses that we learn is a much broader, more holistic view on the body. So that's typically where we differ from medical doctors. And then clinical and modality training. We're way above medical doctors in that respect because we have way more therapies to offer, and we learn a lot more. We learn herbal medicine, we learn Chinese medicine, we learn homeopathy. So this is a really nice synopsis of where we differ in terms of our education. In terms of offering healthcare to the patient, of course, we're all on the same trunk of the tree, right? We're all going for the same thing to help to make the patient feel better. So we're just a little bit different in our education. So that was just a synopsis. I was going to explain, I had little pictures of herbs on here. So this herb that's on here right now, does anyone recognize that herb? Sorry? It is wild oats, yep, Avena sativa. Avena sativa is a really nice nutritive herb. It helps to calm you down. If you make it into a tea, it helps you calm you down if you're stressed out, if you're really nervous and jittery. It's really nice for soothing the digestive system. So it's one of those herbs that I find really helps the whole system of a person. So I look at a person and I can actually think, well, what herb would be best for this person based on their constitution? And Avena sativa I find to be a really nice overall sort of calming for that person who can get really stressed and really anxious where it affects their digestive system. All right, so a typical practice. Excuse me. So I work at Nature Doctors. I work in a clinic with five other naturopathic doctors. So that is typical of naturopaths. Usually we work in private practice. It is definitely, there are examples of naturopaths working in hospitals. Integrative clinics is getting huge, especially on the West Coast where I went to school. I have an example here of Inspire Health. This is an integrative cancer care clinic that's in Vancouver. So this clinic is really interesting because it was started by a medical doctor, but he also works with a few naturopathic doctors in his clinic, and they are pumping out research showing all of the benefits of treating cancer patients with chemo, radiation, all the surgery, as well as with naturopathic medicine with IV vitamin C and mistletoe and different supplements and different diet and lifestyle changes. So, and the research that is coming out of this clinic is phenomenal, and it's because the two streams of medicine have gotten together and started saying, okay, we've got this cancer epidemic on our hands. Let's get together and let's start working together and see if we can benefit our patients better than just doing the traditional chemo radiation. So that's one of those examples. Community health centers, universities, and then private industry. Private industry would be your supplement companies and your different research in different supplement companies and things like that. So in terms of the patients that are most commonly seen in general by naturopaths, patients will typically come in with issues of fatigue, of headaches, of MSK problems, anxiety and depression, menopausal symptoms, bowel and abdominal problems, allergies and skin rashes. So those are the typical complaints that naturopaths will be faced with when a patient comes in. I work at the Nature Doctors, and I just wrote down a list of what are the most typical complaints that come to our clinic. So we are treating a lot of cancer now. We see a lot of male and female specific health conditions, so specifically related around hormones and prostate health and things like that. Joint pain is huge. I do a lot of treatment of joint pain. Irritable bowel syndrome and inflammatory bowel disease, that's just overall digestive health. Naturopaths are really great at targeting digestive health and helping to balance that system. Diabetes and heart disease, autoimmune disease we see a lot of, sports training optimization, we do a lot of that. With the Jets in particular, but I'm not going to say anything more about that. Prenatal and postnatal care, we do a lot of, and then endocrine and hormonal imbalances, so usually for women at any age. All right, so I was asked to talk a little bit about how our occupation is evolving. So naturopathy has been around for decades and decades. The medicine that we practice has been around for centuries, so we just kind of amalgamated all of it together in the past about 75 years or so. But in terms of an occupation, naturopathy has really started to grow, so that a lot of people are finding out a lot more about naturopathic medicine and going to see a naturopath and using it as part of their as part of their general health care. So our population that comes to see us is typically aging. It's the baby boomer population. People are getting older. They find out that they might have some sort of chronic disease. They're on a lot of medications from their medical doctor, and they come to see me and they say, well, I'm on all these meds, I have all these side effects. Is there something that I can do to get off of these meds and live longer? And there is a lot. So I do see a lot of the aging population. Increased scope of practice. So like I had said earlier, in BC, they are now able to prescribe pharmaceuticals. In Manitoba, we are working with Manitoba Health to get lab rights. We do have lab rights, it's just that the patients have to pay out of pocket. We want to be able to offer lab rights to our patients and have it covered by Manitoba Health. And we are, of course, working on getting our prescriptive rights as well, although I don't foresee that happening within the next 5 years, but we'll see what happens. And health as a priority, and that's just the general health. The general population seems to be shifting more shifting more towards putting health as a first priority in their lives and helping them to feel better. So health as a priority is definitely a shift that I've seen within the general population. Okay, so this is just a little quote that I have seen a few times. I don't know if anyone's seen this. So a short history of medicine. So 2000 BC, here, eat this root. 1000 BC, that root is heathen, say this prayer. 1850 AD, that prayer is superstition, drink this potion. 1940 AD, that potion is snake oil, swallow this pill. 1985 AD, that pill is ineffective, take this antibiotic. And 2000 AD, that antibiotic is artificial, here, eat this root. So I like the way that quote kind of summarizes everything. It seems that we are, in general, going back towards the earth and going back towards using the healing powers of nature, which is what encompasses naturopathic medicine.